Hello, this is Angie Lambert, Chief Nursing Officer for CHRISTUS Santa Rosa Hospital Medical Center. It is my pleasure to welcome you to our total joint replacement preoperative training. Over the next hour, RNs, dietitians, and physical therapists will discuss how you should prepare for your total joint replacement surgery. Thank you.
Hi, my name is Julie. I'm one of the pre-admitting nurses here at CHRISTUS Santa Rosa, and I'm going to review with you the portion of this program that entails the time from which you schedule your joint replacement with your physician to the time at which you arrive on the day of surgery. One of the components of preparing for surgery will be the pre-registration component. The pre-registration component involves the following: filling out and signing all your admitting paperwork, providing your insurance information and identification to the admitting staff, making payment arrangements for your copay if that's applicable, and then once you are done in the admitting office, they will bring you over to the pre-admitting nurse and you will speak with the pre-admitting nurse. During this portion, you will be going over your medical history, your medication list. You'll be receiving pre-op instructions from one of the registered nurses. If it is required by your physician, you'll be going over your pre-admitting testing, like your lab work, your chest x-ray, your EKG. If you've already had that done with your primary physician, then we will not be repeating that during this process. There are a few additional things we would like for you to be aware of when preparing for your surgery. If you have any physicians who follow you for a specific condition, such as a cardiologist, a hematologist, an oncologist, we would like for you to notify them prior to surgery to let them know that you're having a joint replacement. They may have some special considerations, or they may want to see you prior to surgery. A few last things we would like for you to be aware of when preparing for surgery. If your physician has given you specific instructions regarding your medications, we ask that you follow those instructions. Some of the specific instances are as follows. You may be instructed to stop any prescription anti-inflammatory medications. You may have been instructed to stop any over-the-counter anti-inflammatory medications such as Advil, Aleve, aspirin, etc. You also may have been instructed to stop any prescription blood thinners that you are currently taking, something like Coumadin or warfarin. If you are taking anything like vitamin A, E, K, fish oil, any herbal medications that start with G, such as garlic or ginseng, you should stop those preoperatively. If you smoke, we ask that you stop smoking 12 to 24 hours before surgery and do not smoke 24 hours after your surgery. If you need information about smoking cessation, please inquire with your physician about the possibility of getting a nicotine patch. Now we will be discussing how to prepare your skin on the day before surgery. This is a two-step process. First, you will be taking 2 showers on the day prior to surgery. One will be in the morning and one will be at night. During this process, you will take a shower using the chlorhexidine liquid soap that we provided to you. You will use half of the bottle to take a shower with. You will lather up with that solution, leave the soap on your skin for 2 minutes, and then after that 2 minutes you will rinse off. You get out of the shower after rinsing off, dry off with a clean towel, and then we will proceed to the second portion of this process. Now we will proceed to the second component, which entails waiting an hour after your initial shower. So what you're going to do is, after you've showered, you've dried off with a clean towel, you've waited an hour, now you're going to open the chlorhexidine wipes that we provided to you. If you open all 3 packages, there will be 6 wipes. Each wipe has a corresponding area of the body that you will be using it on. If you look at the diagram that we provided to you, on the right-hand side, the first area will be your neck and your chest. Number 2 wipe will be both of your arms. Number 3 will be your right and left hips. 4 will be your legs. 5 will be your back, and 6 will be your buttocks. You may need some assistance with getting the back portion of your body. So once you are done wiping all 6 areas of your body, you will have used up all 6 wipes, and your entire body will be damp with the solution, the chlorhexidine solution. You allow this solution to dry on your skin, and then you will go about your day. You will put on your clothes, and you will go about your day. If it is in the morning, if it is in the evening, you're going to just put your pajamas on and go to bed. There are a couple things that we would like for you to be mindful of. If you sleep with pets, we would like for you to make sure that you have clean sheets on your bed, and we would like to make sure that you have clean pajamas to sleep in. So the night before surgery, now that we've taken your shower, you've waited an hour, and you've applied the chlorhexidine wipes that we provided for you. Just a couple more things that we would like for you to be mindful of. Do not shave the surgical site prior to surgery. We do not want for you to have any nicks or cuts on that surgical site. Do not eat or drink anything after midnight the night before, unless you have been instructed otherwise by your physician. Also, one last thing, we do not want for you to use any lotions, moisturizers, creams on your body after you've taken your shower. A couple of other things we wanted to remind you of on the morning of surgery. Do not shave, bathe, or shampoo your hair. When you arrive at the hospital, you will be given 3 more packages of the chlorhexidine wipes and will prep your skin again. You will also be given a betadine swab, which will be put in your nose to apply the betadine inside your nostrils to help prevent infections. If you routinely take blood pressure medications in the morning, we ask that you please take your normal AM blood pressure medication with a sip of water. And if you routinely take blood pressure medication in the evening, we ask that you take your evening medication prior to going to bed the night before surgery. On the morning of surgery, we ask that you come to CHRISTUS Santa Rosa Hospital. The main entrance faces Babcock, and we ask that you go in the front door and go to the admitting office. Once in the main lobby, we ask that you proceed to your left and go to the admitting office. For your convenience, the admitting office is open at 5:30 a.m. Once your registration is complete, you will be escorted with your family members to the pre-surgical unit on the 3rd floor, where a registered nurse will prepare you for surgery. If you have already gone through the pre-admitting process, you will just be giving a new armband, and you will be escorted with your family up to the pre-surgical unit. On the morning of surgery, your surgeon will meet with you in the holding area prior to being taken into the operating room. You will also be meeting with your anesthesiologist in the holding area just prior to going into surgery. 1 or 2 of your family members may stay with you prior to surgery, but some of your family members may be asked to wait in the surgical waiting room while you are being prepared for surgery. Family members and guests will have the opportunity to see you prior to you going into surgery. Once your surgery is complete, you will be taken to the post-anesthesia care unit, and your surgeon will be contacting your family in the 3rd floor surgical waiting room.
Hi, my name is Stacy, and what I do here at CHRISTUS Santa Rosa is I'm a certified surgical assistant. On the first slide here, it's going to show your joint anatomy. A healthy knee versus a right knee with arthritis. The right side image is a healthy knee. The left side is the knee with arthritis. As you can see on this slide, on the right side of the knee, the cartilage has been eroded, exposing the bone. The left side shows a little more components of what the knee is made of. You see the tibial, posterior, and anterior ligaments. What causes knee joint pain? Most common cause is arthritis, causing inflammation of the joint surfaces. Common types of arthritis are osteoarthritis, rheumatoid arthritis, post-traumatic arthritis. During your procedure, your leg will be prepped and draped in a sterile fashion. Sterile equipment and components are used. Air exchanges are also monitored to prevent infection of the surgical site. Our main goal is patient safety. For your procedure, several members of our team will be asking you questions to ensure we have the correct patient. A timeout will be performed before surgery begins. An incision is made in the center of your knee to uncover the joint. Surgical mobilization of muscles and tissues is performed. There are several components that go into the formation of your new knee: the femoral, the tibial, and the plastic spacer. These components are made of metal and ceramic. Step 1 in your total knee replacement. Precise cuts are made on your thigh bone to allow new components to fit your knee. Step 2. Precise cuts are also made on the shin bone to allow a perfect fit. Step 3. Components are then attached to the thigh bone. Step 4. The metal component is secured to the shin bone. To follow, the plastic plate is attached to the top of the tibial component. This helps support body weight, free movement of one bone to the other. Step 5. If your physician decides to resurface your patella, at this time, the backside of the patella is removed. Step 6. If the patella has been removed, At this time, it is attached on the underside of the kneecap. Step 7. All these components combined together form your new knee. Closing after the procedure. At the end of the procedure, we will be injecting pain-relieving medication to reduce post-op surgical pain. After your procedure, it is rare but problems do arise. Possible outcomes can be loosening or dislocation, wear, prosthetic breakage, rare and usually due to improper excessive wear of components, obesity, poor quality of bone, participation in high-impact sports. The quality of life expected after surgery can be pain relief for up to 15 to 20 years in 90% of patients, better range of motion, no need for assistance with walking in most cases. Kneeling and squatting may be uncomfortable but not harmful to the components. Other things that can be expected after surgery is activation of metal detectors, occasional clicking with bending or walking but not harmful to the components. Must continue daily exercises to keep strength and mobility of your new joint.
Hello, my name is Demi Gatewood. I'm a clinical dietitian at CHRISTUS Santa Rosa, and I'm here to discuss the importance of nutrition in regards to your surgery. This is just a brief overview of the topics that we will be discussing today. First, we will look at the elements of a healthy diet, and then specifically talk about protein, and then supplements, weight control, and good blood sugar control for those of you with diabetes. So why is nutrition important? Nutrition is always important at every stage of life, but is especially important before and after your surgery. Studies have shown that well-nourished patients are likely to recover more quickly than those who are not. So what does a healthy diet look like? Well, a healthy diet contains a wide variety of foods from all 5 food groups. You should eat foods from each one of these categories unless you have an allergy or intolerance. First, we're going to be looking at fruits and vegetables. These are low in calorie and contain lots of vitamins and minerals. With fruits and vegetables, we want to make sure that we're eating a wide variety of them to ensure that we're getting in all the nutrients we can. A good way to do this is to ensure that you're eating fruits and vegetables of various colors, like orange, yellow, green, red, and purple. Moving on, we have fats and oils, and it's recommended that we consume mostly plant sources of these, such as nuts, seeds, and etc. We want to avoid added fats from fried and/or processed foods. It's also recommended that we consume heart-healthy omega-3 fatty acids, which can be found in foods like olive oil, canola oil, walnuts, and cold water fish like tuna, mackerel, and salmon. In the center, we have proteins, and we'll discuss more of this on the next slide. Then we have dairy, and these are also considered a good source of protein, and it's recommended that we consume low-fat versions of these like 2%, 1%, or skim milk. Lastly, we have grains, and these are sources of carbohydrates, which is your body's primary source of fuel and can be found in foods like cereals, rice, breads, and pastas. It's recommended that we get at least 50% of these from whole grain sources. So now we're going to talk a little bit more about protein. So protein will be very important after your surgery as it promotes wound healing and helps build and repair muscle tissue. So there are 3 main categories of protein. We have meats, fish, poultry, and eggs, which is what most people think of when they think of protein. And so with these, we want to make sure that we're consuming lean cuts of meat. And with poultry, we want to make sure that we're removing all of the skin, because this is where all the fat's going to be. Next, we have dairy. So dairy is also considered a protein source. And again, with these, we want to make sure that we're consuming low-fat versions of these. And so these foods include cottage cheese, yogurt, and milk. You can also get protein from soy, almond, and coconut. However, almond and coconut have limited amounts of protein, but soy milk is considered a complete protein. Lastly, we have plant sources, and these are going to be found in things like legumes, nuts, and seeds. So a common question that patients may ask is, should I take a supplement? And that's a good question. If you're able to take in a wide variety of foods, you may be able to get all of your vitamins and minerals through your diet. However, if you have an allergy or intolerance, you may require a supplement. You need to make sure that you are discussing any medications or supplements that you are thinking about taking or currently taking with your physician. Your physician will be able to better determine whether or not you will require a supplement. Your physician may require a calcium or vitamin D supplement that will help with strong bones. You need to make sure that you're also taking the vitamin D supplement with the calcium so that it's better absorbed. Make sure that you're not using supplements as a safety net. You still need to eat all of your fruits and vegetables. So next we're going to talk about weight control. So diet can only go so far. You'll need to incorporate exercise into your lifestyle after your surgery, which should be easier after you have your new joint. Just make sure you get clearance from your physician to do so. You also need to make sure that you're maintaining your weight, or lose some if it is appropriate. If you find that you're gaining a few pounds, try to be proactive about it. It's easier to lose 2 to 5 pounds than 10, 15, or 20. Next, we're going to be talking about good blood sugar control. This is specifically important in those with diabetes. If you are monitoring your blood sugars prior to your surgery, make sure that you continue to do so afterwards. Good blood sugar control is very important, as high blood sugars can make healing difficult and can lead to infections, both of which can be problematic after your surgery. So this slide is in reference to how we do food service at this hospital. We provide a room service style food service, and generally how it works is you'll be placed on a clear liquid diet and then will be advanced to the diet that your doctor deems appropriate, whether that be cardiac, diabetic, or regular. Then your nurse should provide you with an appropriate menu, and on the menu you will find a number to call to place your order. The diet clerk will help guide you through the rest of your order. The kitchen is open from 6:30 a.m. to 6:30 p.m. You can get breakfast all day long, and the lunch and dinner items begin at 10:30 a.m.
Hello, my name is Enrique Sanchez. I'm an orthopedic program manager at CHRISTUS Santa Rosa Medical Center, and this part of the presentation we'll be talking about your hospital stay. This part of the presentation we'll be talking about the Orthopedics and Neuroscience Center. We'll be discussing post-operative monitoring and management, pain management, your daily activities during your hospital stay, patient and family education, discharge planning and preparations, and your length of stay. Part of your post-operative monitoring and management, we'll be discussing vital signs that are monitored routinely. We'll also be discussing blood draws for lab work, which will be completed if necessary and prescribed by your physician. We'll be discussing surgical site dressing changes, which will be routinely or per your physician's orders. Your surgical site will be assessed routinely for drainage, circulation, sensations, and swelling. Your dressing will be changed per your physician's orders. Your IV will be in place for fluids until solid food is tolerated. We'll also be prescribing 3 doses of antibiotics. We'll also be using your IV for medications as needed. If you do have a urinary catheter in place post-operatively, the nurse will assess and remove the day after surgery. This is the universal pain assessment tool that we will be using throughout your hospital stay. The staff will continuously ask your scale of pain from 0 to 10, from 0 being the least amount of pain and 10 being the most extreme pain that you can imagine. We'll be utilizing this tool routinely so that we can monitor and control your pain either through medication or through different techniques. For pain management, oral pain medications will be prescribed versus IV pain medications. Oral pain medications provide longer lasting pain relief, fewer side effects, and better tolerance of physical therapy. Nausea is a common side effect of anesthetics. For nausea management, your physician will order IV medications. We will be advancing your diet as tolerated after surgery, starting with a clear liquid diet. We will also be monitoring gastrointestinal activity. Another side effect of anesthesia is constipation. We will ask you to try to have a bowel movement prior to your surgery. We will ask you to alert the nursing staff if you have a previous history of constipation post-operatively. Medications and prune juice are available for history of constipation. One post-operative complication is blood clots. Blood clots are the results from decreased mobility and slow circulation after surgery. We would decrease your risk for blood clots by administering blood thinning medications. We will be applying TED hose or compression stockings to your lower extremities. We will also be using alternating pumps on feet and legs. Exercise and getting out of bed as soon as possible after surgery is crucial in decreasing your risk for blood clots. Another risk of having surgery is infection. Any infection in your body can spread to your joint replacement in the wound or deep around the total joint prosthesis. Antibiotic medications will be provided. Antibiotics through your IV during surgery and post-operatively will be administered. A primary way of decreasing your risk for infection is wash your hands and or use hand sanitizer before touching the surgical site.
Beginning the rehab process. Hi, my name is Della Wilhelm. I am a physical therapist. I am also the Director of Rehabilitation Services at CHRISTUS Santa Rosa Medical Center Hospital. During this part of the presentation, we will be discussing the beginning of your rehabilitation process. The goals of the orthopedic program with your rehabilitation services are to maximize your function and to maximize your progress during your hospital stay. In addition, also to aid and assist in the smooth transition to your next level of rehabilitative care. The typical length of stay in the hospital is approximately 1 to 2 days. You will have a very active stay while you are here in the hospital. You will be receiving physical therapy and occupational therapy services. Physical therapy, or PT sessions, you will receive twice a day, Monday through Friday. If you are still in the hospital on Saturday or Sunday, you will receive physical therapy services as well, at least daily. We will try our very best to see you twice on those days as well. An occupational therapy, or OT, evaluation will also be completed to assess your needs. We work together as a team at CHRISTUS Santa Rosa Medical Center to provide your care. Some of the team members, physical therapist, your occupational therapist, your nurse, your physicians, your case manager, you as a patient, your caregiver, and family members, and many others here at CHRISTUS Santa Rosa Medical Center to provide any services that you may need. What you are now viewing on this slide are a few pictures of our Orthopedic and Neurosciences Center. The pictures to the right are pictures of our private patient rooms on our orthopedic unit. The GapFlex is a device that your surgeon has ordered for you to use while you are here in the hospital. This device is to help you improve your range of motion after your knee surgery and help in your recovery. Your nursing staff and your therapy staff will help you. They will educate you on the purpose of the GapFlex. They will educate you on how to set it up and how to utilize it. The goal for utilization here while you are in the hospital is to utilize the GapFlex at least 6 times a day. And each time that you use the GapFlex device, it'll be for 6 minutes at a time. Further instructions will be given to you by your therapy staff and by your nursing staff. Your stay here at the hospital will be a very active stay. Your surgeon has requested that your physical therapy staff work with you on the same day of your surgery. So after you are on the orthopedic floor and after you are assessed by our nursing staff, your physical therapist will come to your room and perform an evaluation. They will ask you a lot of questions. Some of the things that your physical therapy staff will work with you on will be getting in and out of bed, getting up and down from a chair or a toilet, walking with a walker and going up and down stairs and curbs. Your stay in the hospital will be very short, so we will at least try to go work with you going up and down curbs. If there is time and you have a need, we will also work with you as far as walking up and down stairs. We will review your home exercise program to increase your range of motion and to improve your strength. We will discuss and review any weight-bearing status as determined by your doctor, and we will also instruct you in any post-surgical precautions. The picture that you are viewing is a picture of our inpatient therapy rehab gym. In the back of the picture, you will see a set of stairs, and those will be the stairs that we will utilize when working on instructions on walking up and down the stairs with you. There may be an opportunity that we may also bring you to our inpatient rehab gym to work on some other exercises as well. Here are a couple of pictures of some knee exercises. The first picture is a picture of the quad set exercise. The second picture is a picture of the straight leg raise exercise. Your therapy staff will instruct you on how to perform these exercises and other knee exercises to improve your range of motion and improve your strength during your recovery. In the back of your patient education binder, there are some other exercises as well. In addition, your therapy staff will provide you with written exercises for your home exercise program. We will go over all of your exercises and instruct you in how to perform them during your therapy sessions in the hospital. A member of our occupational therapy staff will also work with you while you are in the hospital. They will assist you in planning, practicing, and modifying daily activities. They will work with you on grooming, dressing, and self-care. They will also instruct you on the use of assistive devices as needed for safety, self-care, and home management tasks. In addition, they will provide instructions for home safety. They will also give you a home exercise program and instruct in post-surgical precautions. We want you to be very successful. We want you to be able to improve your range of motion, increase your strength, and your endurance. So we encourage you to walk. However, it is not a substitute for exercise. The success of the operation will depend upon your continued participation in your exercise program, not only here in the hospital, but also after you leave the hospital. The exercises that we will provide to you, both in writing and the ones that are in the back of your patient education binder, as well as the exercises that you will receive in your continued therapy services after you are discharged from the hospital, will help you to build your endurance and your stamina, to increase your range of motion, to increase the strength in all your muscles of your leg, and to restore any function that you might have lost prior to your surgery. The discharge planning will be discussed with you by your doctor and your case manager. Your case manager will come to talk to you shortly after you arrive on the orthopedic floor. Your case manager and the therapy staff will assist you with selecting equipment that you may need, and they also will discuss with you how to obtain the equipment before you go home. After your discharge, your physician may order home health services. And if your physician does order the home health services, they are typically 3 to 6 hours per week. Physical therapy is usually the primary focus. However, your physician may also order occupational therapy and nursing services. Your case manager will be able to go over the specific guidelines and help you with your home health services. For preparing for your discharge, we would like for you to look at your home and do a home safety checklist now, if possible. Some of the things that we'd like for you to look at and ask yourself, do I have enough lighting in my home? Do I have a good pathway to walk with my walker or your other assisted device that you may utilize? We want you to be safe, so if you can look at your home now and remove any potential trip hazards, that would be best. Some of the things to look for: do you have any throw rugs? Do you have any cords? Anything that might be a potential trip hazard. We also would suggest that you would wear comfortable low-heel shoes that provide good support. Shoes that have a lot of traction, of course those that are not slippery, and shoes that support your whole foot. We ask that you follow your physician's and your therapist's instructions about your post-surgical precautions. Your loved ones that might be helping you through your recovery process. We ask that you please take care of yourself as well, to prepare your home as well. Be familiar with your loved one's medical history and medications, and to think about your support system, just in case something happens and you're not able to take care of your loved one on that particular day. Is there someone else that you could call that could also assist to help? In addition, we also like for you to think about preparing any meals ahead of time, kind of what was talked about before in our presentation about preparing meals, but making sure that they're also nutritious and high in protein. Outpatient rehabilitation is another means for you to continue with your rehabilitation services after you are discharged from the hospital. Your physician may order outpatient rehabilitation, but it will depend upon your progress. The outpatient rehabilitation is usually about 1 hour in length and usually about 2 to 3 days per week. The level of outpatient rehab is at a higher level of rehab to allow you to return to daily and leisure activities. Some of the things that they will work on are muscle strengthening and more range of motion exercises to achieve your full range of motion. They will also work on exercises and activities to build your endurance, to work on balance and fall prevention. It may include aquatic therapy. They will also work with you on education and other exercises to return you to work, sport, or leisure. The typical duration of outpatient rehabilitation is typically about 4 weeks, but it can vary. Everything is individualized depending upon your needs and what you and your physician discuss and feel what would be needed for you to recover fully. The pictures that you are looking at now are a few pictures of our outpatient rehab center at Medical Center, some pictures of our rehab gym, our indoor heated pool. The important thing to remember is that for you to receive some sort of rehabilitation services from a skilled therapy staff after your hospital stay, you and your physician will have that discussion of what is most appropriate for you and your recovery process. In closing, our goals for our presentation were to educate you on your total joint procedure and the process for recovery, to start planning on your discharge now, to help decrease your anxiety and stress about the surgery, and to answer any questions that you may have. If you have any further questions, you can ask any of our joint replacement staff. In the back of your patient education binder, there is a page that includes some helpful phone numbers in case you have any further questions. We would like to thank you for your participation and for viewing our presentation. We hope that you found it very helpful, and we wish the very best for you. May you have a quick and healthy recovery. We also want you to have a great experience during your stay with us at CHRISTUS Santa Rosa Medical Center, so please let us know of any needs that you may have. And again, thank you for choosing CHRISTUS Santa Rosa Medical Center for your joint replacement.